Good morning. It's my pleasure to introduce our hospital's president, Diane S. Hupp, for a special Grand Rounds State of the Hospital today. I'm Noelle Spears. I'm the Vice Chair for Education for the Department of Pediatrics. Diane has more than 30 years of healthcare experience while serving in multiple roles at UPMC Children's throughout her career. She has spent the last 2 decades leading nursing and hospital operations, including key initiatives in patient care and safety, technology, process changes, and the training and professional development of nurses, as recognized by achieving magnet designation since 2012. Prior to serving as our president, Diane held dual role as a chief nursing officer and vice president of operations of UPMC Children's for nearly 2 decades. During that time, her vision and leadership led to the opening of a pediatric hospital within a hospital concept, bringing the expertise of UPMC Children's to central Pennsylvania. And in collaboration with surgeons, she also spearheaded the Pediatric East Coast Transplant Network, resulting in more opportunity for children awaiting transplants. Diane holds a master's degree in nursing administration, a bachelor's degree in nursing from Duquesne University, and a doctorate in nursing practice from the University of Pittsburgh. Diane's contributions to the healthcare industry in clinical care, leadership, and research have been widely recognized. She has received numerous awards and honors, including being inducted into the elite American Academy of Nursing, and most recently, she became the inaugural chair for nursing excellence at UPMC Children's. We are honored to have Diane here today as our Department of Pediatrics Grand Rounds speaker and look forward to her insights on healthcare at UPMC Children's. Please welcome Diane Hupp.
Good morning, and thank you, Dr. Spears, for that very generous introduction. I'm grateful to be here today. I know many of you in the room, but I also know we have several who have dialed in virtually. And I first want to say a big thank you to every one of you. Thank you for taking time out of your schedules to be with me this morning. Thank you for what you do each and every day here at Children's Hospital. It's not easy, the roles that you all play. We mostly have a physician group here today and many online. This past year has been quite challenging. We know that the past few years, but in particular the past year, I think it's taken a toll on many of us. I look at it as a big opportunity, an opportunity where together we can continue to elevate the work we do here, but also to help each other get through these challenging times. I'm thrilled to be here. I first want to say thanks to Dr. Terry Dermody, who gave me the invitation to give the State of the Hospital address. I also want to thank Dr. Spears and the entire education committee here that puts together the Pediatric Grand Rounds. Today, and I know many of you, but for those who do not know me as well, and there may be some online, there are many familiar faces in the room here, but for those who may not know me personally, as Noelle said, I have been here for my entire career, starting as a volunteer in 1985 and hired in 1986 as a child care assistant. A nurse by background, served in many different roles here, and probably the most impactful to myself personally, and hopefully to many in the organization, was my chief nursing officer role. I do have a passion for healthcare, a passion for nursing, and a true passion for leadership. I love being a part of this great organization that has a history of a legacy of excellence, of improving the lives of our children and their families, and frankly, each other. So with that, I would like to start out with some wins. I'll talk about our strategic priorities. We have a few that together we have identified over the next couple of years, really 4 big strategic priorities. There's many foundational pillars that will make those priorities happen and execute well. And I'll dig into a couple of them in more depth. But to start with, I'd be remiss if we didn't start with some opportunity or some recognitions that I want to make. The first ones are really organizational. And when I say organizational, it takes all of us to make these happen. Sometimes I think we believe they take them for granted. When you think about organizational excellence, quality, safety, efficiency, these are all well known to you. But I don't believe they happen by chance. I believe they happen by choice and by a lot of hard work. All of you in the room and those online and so many more have been a part of elevating our national ranking to number 6 in the country. Noelle mentioned in my introduction, the 3 magnet recognitions. There's only about 3% of organizations, national and international, that have been able to achieve 3 consecutive magnet designations. That is not only a nursing recognition, but it's an organizational recognition. It takes all of us to make that happen. We're one of 2 in the state that received CARF accreditation for our new rehab unit that we're so proud of. This past year and 2 years in a row, the Huron Group, which is a national consultant who focuses on patient-family engagement, we received the national award for sustained excellence in our patient-family satisfaction scores. We're proud of that. We also received Leapfrog. We've received it a few times, but not consecutive. But in 2022, another great year for quality, safety, and efficiency is what Leapfrog really focuses on. So our hospital-acquired infections, work we do with flow, work we do with the patient-family experience, that's the focus of Leapfrog. Our pediatric APPs, and special shout out to Whitney Lurch, who has led our APPs, and her team, and Katie, we were able to get accredited. Again, one of the few in the nation that have been accredited for our APP fellowship program through the American Nurses Credentialing Center. And more recently, Doximity. We were recognized as one of the top 10 pediatric residency programs, and those were rankings by physicians. These are a few of our many accolades that we have been able to achieve, all of which in calendar year 2022 came through. We should all feel really proud about working in an organization that has achieved that recognition, again, not by chance, but by choice and by hard work. When we look to move forward, that was our past year. I've had the privilege and honor of serving as the president for just 1 year. It has been last February. And I couldn't be more proud of the accomplishments in our first year. We want to look forward, and we want to continue to have hope and aspire to do more and aspire to elevate our levels of excellence here at the organization. And when we think about looking forward, we know we have challenges. We know that some of our healthcare workers and even in some of our physician subspecialties, it's a challenge for recruitment. We're not optimally where we want to be. I acknowledge that. We know we have opportunities to continue to excel and do more in the DEI space. We know we have challenges with competitors. We know that the giants of Amazon and CVS's, they're coming at our back doors. They will focus on the smaller part of healthcare, but yet turn it into probably something big as it relates to what can be done to step to where our consumers are and meet them where they're at. We need to create that ourselves. The best way, and I love this quote, the best way to predict the future is for us to create it. And we do have that opportunity. There's great movement to the ambulatory footprint. One of the strategic goals of our UPMC health system, and you may have heard, there's a new community and ambulatory division. And that division is going to focus on a lot of what our competitors are trying to focus on: primary care, access into our community pediatricians, and in the adults as well, primary care practices, movement more to ambulatory surgery facilities, looking at IDFS strategies to lower the cost of care. These are all strategies that will be really important for all of us to engage in and to continue to move forward as we advance our community and ambulatory footprint. There will still remain, and as we have seen over the past year, a high demand for our pediatric care. This is a snapshot. I'm not going to talk a lot of numbers to you today. You know that, numbers in dollars, but it's impressive when you look at year over year, calendar year 21 to calendar year 22, the impressive acceleration of all services, from our inpatient admissions to our surgeries. When you look at surgeries, we've been down 2 ORs. I see a few surgeons in the room. It's been really hard. We're getting one back up and running. But despite the fact that we have decreased our OR space, we've been able to increase our overall volume. That's impressive. Much of that has been done in the ambulatory surgical facility at our North Surgery Center. We've been able to put through nearly 8,000 children at our North ASF. That's a lot of cases. We do about 12,000 here in the main in our 12 ORs. We know it's a different case mix, it's a different acuity, but it's still rather impressive. And we're continuing to focus on recruitment and retention of our anesthesia providers that'll help us be able to increase our access to our ORs. Our ED visits continue to remain strong, not quite where we were pre-pandemic, but they're quite strong, up 5%. The outpatient visits, certainly when I talk about outpatient visits, the CHP outpatient visits, we're talking more on imaging, therapies, PTOT speech. The physician encounters are under UPP, and you can see they're up almost 5%. If I added January on, last month, 2 months ago, was a very busy January. Outpatient visits for our providers went up over 10% in comparison January last year to January this year. Very impressive, and we're grateful for the hard work and efforts that each of you and your teams are putting forth to make that happen. Our CCP visits, sometimes I believe some of, particularly in the ED and even providers say, are our physicians in CCP still seeing the same number of patients? Because it seems we're seeing so many more here at our main hospital and our express cares, but they are. You can see they were up 13%. When you look at express care alone, we opened up a couple more express cares, one of which was right here in Lawrenceville. We had ceased that operation during COVID, but we felt it was important to open it back up. And I thank Dr. Hoberman and Ed Gold and his entire staff, Lori, to help us do that at a time when they're working to get their staff back to optimal staffing. But you can see the growth in express care visits. We know that in our ED, out of the 80,000 children that come in our ED, we admit 1 out of 5. We know 80% we send home, roughly. That may shift 1% or 2 each month. But generally speaking, we're trying to look at how we can take care of these children in alternative sites. They all don't need to come to our ED, and we know what it does to our ED. So we're working on that. How are we managing, and how frankly, do we get through this past year when you look at those significant and impressive increases in volumes? We are probably one of the few hospitals in our region here, and particularly in our health system, that's been able to keep every one of our beds open. And not only keep all of our beds open, but actually open additional beds. We opened up 10 additional beds up on the 4th floor, unlicensed, but we have overnight patients. Today, we opened up an additional 10. There are 20 children up on the 4th floor, albeit impacting surgical operations, that are overnight patients that needed admitted through the night. We had a huge surge. Today, we're at a census of close to 350 patients in the house. 20 sitting on the 4th floor, and we have another close to 20 sitting in our ED for beds. The demand is great. Our ED providers, Dr. Ray Patetti and Dr. Conti, the entire ED team has worked very hard to help us utilize different spaces. When you look at that, we opened an outdoor military tent that helped us through our pediatric surge, particularly with the RSV. Last week, we opened up 10 more bays on the 1st floor adjacent to the emergency department in a space that used to be used by Child Life. There was somewhat of a office storage space. We have new bays in there to help with ED throughput. And we know when the ED gets busier, each of you get busier. In particular, our hospitalists. Our hospitalists, we have a few in the room here today. I'm grateful for the work you're doing to keep up with the demand upstairs. We know that on average, I might not have your numbers exactly correct, but on average, you're running a census of maybe 50 or 60, but it's gone up to 80 or 90 or more. It's near doubled. And we're working hard to help to support in getting additional resources in. Our average length of stay, thank goodness, we have been able to manage that well. You know, in the adult facilities that have had closed beds, it's tough to get into skilled nursing facilities. Patients are stuck. Here, we have been able to keep our length of stay at around 6 days, which is pretty good. Our employee hires. So we know we have about 3,000 frontline employees here, excluding our physicians. We have been able to increase by 38% when you look year over year of new hires. That's great. When you look at the physicians, and I'll have a slide on that a little later that Mike Comey and I'll help to put together, but with our physicians, we went up about 5%. We are looking to recruit. We do want to hire. We want to make smart investments in our physicians to continue to be able to meet the demand. And I did share with you the impressive express care and virtual care options. So this is how we've been able to manage during these turbulent times. Unlike many others, we have been able to expand here, and it's been rather impressive. There are 3 areas of focus that I'd like to take a look at today and provide you a little more information. To me, these are the exciting parts of what UPMC Children's Hospital is doing. The first strategic priority, whoops, I think, is there a slide missing? Here it is, apologize there, is growing our pediatric service line. But I want to share with you here strategic vision and priorities for the hospital. Some of you maybe have seen the Vision 2025, and it looked like a color with a lot of a house cover. It had several different areas of focus, most of which are on the bottom. They are still areas of focus that we will continue to invest in. The growth, the quality, the service, the people, innovation, finance. We need all of that to execute on our strategic priorities. But we've really outlaid 4 strategic priorities over the next couple of years. This will continue to evolve. But one is growing our service line. Second is how we can better meet demand of children and adolescents that need pediatric behavioral health. We are investing in our Heart Institute, the number 2-3 program in the country. We have outdated cath labs. They've been here 15 years. We need new equipment, and we are growing. And we are also want to certainly continue to invest so that we can lead with scientific discovery, innovation, research. These are 4 major priorities. I'm not going to read to you all the bottom. We're going to touch upon some of what's on the bottom of this, because for us to do any of these 4 strategic priorities, we need resources and dollars, we need people, we need to continue to deliver on the quality, the safety, and the service in all of the 4 priorities. So with that, let me start on our first one, which is growing our pediatric service line. This is a map that showcases how much we really have grown over time. We have well grown beyond the 4 walls of the Children's Hospital of Pittsburgh here in Lawrenceville. Particularly to the right of the map in central Pennsylvania, in our Harrisburg Hospital, we have grown services. I believe we have 13 subspecialties that are seeing patients, mostly on the ground. Some are doing virtual and telemed. More recently, we've put neurosurgery, orthopedics, we've hired a second general surgeon, a lot of growth. We're looking at ophthalmology and looking at a few other services. We've had specialty clinics, but they continue to grow in areas such as Johnstown and Hermitage. Would like to do more in Wheeling, given the competitive landscape of WVU, in Washington as well. And then Cumberland, Maryland, with our Western Maryland UPMC hospital, we're looking to provide more pediatric services there as well. And this past year, we've grown with GI, endocrine, nephrology, and neurology, and looking to do more. In particularly, I call out 2 of these. The Central Pennsylvania one, which we did stand up the UPMC Children's Harrisburg Hospital, and up by Hammett in Erie. The UPMC Children's Hospital in Harrisburg continues to grow. And over the past year, there's been significant growth. Discharges were almost up to 1,000 discharges. That was a 26% increase over the prior year in overall discharges. The specialty visits that I mentioned, there are 13 subspecialties that we provide service, have actually increased 62% over calendar year 21. Primary care visits, we have 3 CCP offices, and we have grown 30% to over 100,000 primary care and express care visits. We also have an express care up in central PA in Hummelstown. We have recently, with Mike Communal's leadership, put together a key physician leadership recruitment and actually a structure that includes a medical director of the ped service line, which is Dr. Sean Safford. He is a general surgeon by trade. He was recruited from Hershey, PA. Some of you may know him. Strong leadership skills, has a military background. He's done very well, and he was just recently announced as the medical director for that service line in Harrisburg. He will work very closely with the core leadership here at UPMC Children's. There's an Associate Regional Medical Director of Newborn Medicine, and some of you may know, Dr. Carrie Welsh from our neonatology, and an Associate Medical Director of CCM. There was just a recent change made there of Dr. Rebecca Smith. So it's very great to see a few of our familiar names that will be helping to lead our central PA services. And we're still recruiting for pediatric hospital medicine. Hammett would be the second area that I've picked out of that map to let you know that we're continuing to invest and would very much like to do more up in our northern region. Right now, we've been working with the emergency department, been working with the hospitalists on the inpatient unit. We have had a specialty outpatient care center there, but we're looking to do more, and they're looking to invest more to get particularly some additional hospitalists on the ground there to support the inpatient unit. We do have 3 CCP practices up there and express care, and we also, just a few miles down the road from the Hammett Hospital, is the Shriners Hospital, where we still do have a collaboration with our orthopedic division here in Pittsburgh. And they're up there a few times each week seeing patients. As we continue to grow, one of our strategic goals was to bring our rehab unit back from down the street at the children's home back here to the main campus for a few reasons. Number one, we were out of space at the children's home, and we wanted to have more beds, and we wanted them to be all private. Number two, in addition to the additional space, we recognized that it was sometimes challenging to move patients to the rehab as quickly as we would like. And these are patients that for every day earlier we can start rehab, it will help them overall in their outcomes. So with that, I can tell you just last week, we opened up the rehab unit up on 7D. I want to give a special shout out to colleagues who work primarily on 7C. We had to rob a few spaces up there to make 7D happen. And it wasn't necessarily that it was an intentional, we just want more space for the rehab, but there are codes that we had to abide by to get this unit regulated by the Department of Health that required excessive square footage for each and every patient room. So with that, we did have to take a little bit from 7C and even a little bit from over on 7B and some support space. So I'm grateful for the patients throughout the transition and the construction period. We do have a beautiful new unit. These are a few pictures as you enter into the building. You will see the colors, the artwork, the private rooms, the spacious gyms, the technology. We have technology in each and every room that is able to transition these patients. You can see to the right picture above, there's a lift hanging, and this is an electronic lift that can pick the patient up out of the bed, get them into a chair and into the bathroom and into the shower. So this is a track that runs on the room. This is the only rooms in the hospital we have that technology. We also have a 0G in our gym. You can see on the ceiling there, a portion of it. We're grateful for friends from the foundation that helped to make that happen. But this technology will be used primarily by our physical therapists to help with gait and balance therapy of these children. Week 1, we already exceeded our historic 8 patients at the rehab, and I'm pleased to say we're at 9 patients, and the movement has been quicker. Wanted to mention emergency care. When you look at the emergency care and expanding the footprint there, we started an ED affiliation program a couple years ago, and we continue to grow in this space. And I'd be remiss if I didn't call out Dr. Stephen Janofsky and Molly Gibson, who have been leading these efforts. You can see on the map several of the different UPMC hospitals and also Trinity Health that we have an affiliation agreement with, in which the primary goals here are to elevate pediatric care in these adult facilities. We know that many adult facilities, if not all, out of all the patients they see in the emergency department, they see 10 to 15% are children and adolescents, and we want to help them to do better. So we've been expanding through telemed, through education, through gaps of assessment on equipment, and couldn't be more thankful for the leaders who have been helping us to lead with this great initiative. We also began a concierge service. The concierge service means if you are in RED And also we've started at Passivant and a couple others, and a patient leaves the ED and needs a subspecialty appointment. We have hired 5 individuals that we're able to call in at the time the child's in the ED and schedule an outpatient appointment. And week by week, the numbers are increasing. We're not at 100%, but I can tell you, I look at the numbers and we're probably scheduling about 100 a week, which is impressive. And I think from a patient family satisfaction and a customer service perspective, they're very pleased to be able to leave an emergency room and have a follow-up appointment scheduled with a subspecialist. Speaking of subspecialists and access is truly a key to our growth. I didn't really think, I know we're beyond our beds today, but when you think about all the predictions of pediatric populations, and we just looked at them last week, look to be declining, one would not think that we would continue to grow from the inpatient space. There's a lot of ambulatory growth. My personal belief is some of this is happening not just because we got through a high RSV and pediatric respiratory surge, but also we are seeing more patients from outlying hospitals that may have dabbled in pediatric care, but are sending those patients to us quicker through our med call system. Those numbers are up pretty significantly from outlying hospitals, both in our health system and particularly out of our UPMC health system. So when you think about access and being our front door, and this is just a picture of when you are a patient, a new patient, and you can say this for yourself, and you're trying to get care, it's a challenge. It's a challenge to get in for an appointment. Who are your options out there? And I'll personally say, I just learned that my primary care physician, who thank goodness don't need them too often or don't bother them too much, but we should have a PCP. Mine just retired, went to do something else. So I'm like, oh, I've had him for quite some time. So I'm online just trying to Google through who should I get as a new PCP. It's not easy. Putting in my zip code and putting where I live, but it's not easy. So when you think about this, and then when you do have someone, you say, I want to get in for an appointment, it's going through a lot of calls. It's sometimes calling back, waiting to call back. How do we make this easier? How do we enhance the consumerism? Access will win the game here. And for years, I believe we've thought we are the game in town. We are the only children's hospital. But I don't need to tell you that we are seeing some competition out there. And we will continue to see some competition out there. So we want to continue to focus on our access. I also believe that not only is there competition, but if you're a parent and you're waiting and waiting to get a child in, sometimes the wait, it gets too long that they say, I'll go where I can get in, even though they probably know the quality of care and the service is better at a top children's hospital, but they can't wait and they don't want to wait. So the timeliness and the ease and the consumerism of being able to schedule online, appointments online, very important. And it will be our driving force for growth as we move forward. Dr. Ken Michelle was named more recently as our medical director of digital health. He's been in that space for quite some time and was pleased to have him appointed. He is putting together a strategic plan for our digital health and how we continue to grow in that space. I'm going to move on to behavioral health. That was a little bit about how we're growing our service line and some of the things we want to continue to do. Behavioral health is very important. And I'm most certain if I asked everyone in the room here today and those of you that have dialed in, how many of you know someone? How many of you have someone in your family? And you know maybe a close friend or a family member that is looking and needing behavioral health. I would imagine that at least half, if not maybe 3/4, would raise their hand for that. Myself included, I have a family member and it's tough. It's tough. You can all appreciate what it means to know someone and love someone that struggles with behavioral health. One of our top strategic priorities is to make it easier, is to increase access. And I want to share with you a few things that I believe have been success in the past year, but a little more on what more we need to do moving forward. When you think about behavioral health and accessing behavioral health, There are domains from the prevention and wellness, which we want to try to improve upon, all the way to the emergency and crisis care and all of the different continuum of care steps in between. Rachel Petroselli, myself, and Dr. Deb Brodeen this past year from Western Psych led an engagement with the consultant group, the Chartist Group. That group helped us to, number one, look at what current services we have now, but most importantly, what we need to focus on in moving forth to close the gap. I'm not totally optimistic that we're going to close this gap 100%, but I am very optimistic that we are going to do better and do more than we do right now in this space. So when you look at what we've done over the past year and just pulling out a few of those domains, our primary care, we do have 20 practices or 31 sites with embedded behavioral health, and we're planning for expansion. Dr. Alejandro Hoberman and working with his team to say, how can we recruit more to do more in the primary care space? We see thousands of patients now through CCP that have behavioral health visits every year, but there's more. Number two, in our emergency department this past year, we have invested in 2 clinical evaluators. These are individuals that live in the emergency department, and they're helping us to look and evaluate patients that come in. They may have medical issues as well, but some of them are here for strictly behavioral health. So looking at those patients and helping our pediatricians in the ED determine what's the next step for these patients. We have actually seen, and I'm really proud of this, 37% decrease in transfers to Western Psych or Southwood or other inpatient facilities. We would have said a year ago, we had about 35 a month that were coming in that we would say, not sure what to do, not sure how to handle this, we need to send them to Western Psych. We've now been able to decrease that to 22, and there's probably even more we can do. They all don't need inpatient care, but we need to give them some help. How do we get them in a program? How do we get them resources for outpatient facilities? Can we do a brief intervention? Those are things we're working on. From the inpatient, you know, we have a behavioral health liaison program, a consultant liaison program, the CL program here. We did over the past year add a resource of a nurse coordinator. Stacy Cody was in that role for a while and moved on, but I want to give her accolades. She did excellent work with Dr. DeLope and the inpatient behavioral health consultant liaisons to be able to decrease hospital days. And it's not just about the avoidable days. When we talk about an avoidable day, we're talking about children that are in this hospital that are medically cleared that really should be somewhere else, whether it's home, whether it's another facility, whether it's a psychiatric facility. But with the help of our clinical liaison behavioral health specialists and the nurse coordinator whose full-time job was to help these children and adolescents get to where they need to be quicker, we're able to have a 70% decrease in avoidable days from roughly almost 90 a month to 27 days a month. That's impressive. That's impressive. And we need to do more. Some of our issues are waiting for space and waiting for beds, but there's also a piece before that that we need to navigate and ensure we're sending them to the right place. For our subspecialty clinics, I've heard from many of our chiefs on how do we increase support, behavioral health, right here in our own clinics to support the subspecialty divisions. And I'm proud to say over the past year, we have increased from 14 to 21. So we've done more, and we're looking to do even more. Our top initiatives for behavioral health and looking ahead, and this primarily came out of the engagement with the Chartist group that I was referring to, was number one, focused on navigation. It is hard to navigate and understand. If you have a child or adolescent, probably even an adult, where do you turn to? Who do you go to? Who do I call? Where's the right place for my child or teen? I get these calls and emails a lot, and I phone a friend. But what we want to do is be able to establish a call center for patients and families, and eventually even referring providers, so that there's a one number that you call and they will be answer. It'll be pediatric focused, and they'll be able to help you get to where you need to go. Is it an outpatient appointment? Is it an inpatient, an IOP, an intensive outpatient program? Is it a partial program? Where do we have all of these programs? Is there help in certain schools? Part of this is collecting all of what we're doing now and expanding upon it, but streamlining how our children and adolescents will get there. We also want to develop a behavioral health walk-in clinic, and we have. I'm very proud and need to thank Dr. Abby Schlesinger, Kristen Straka, who has put together a behavioral health walk-in clinic. I'll touch upon this in my next slide to tell you a little bit more about this clinic and what we plan to do. I don't want to call it a crisis clinic because it's not going to be for crisis. There are places where we need to send children if they're in full crisis. We also believe, and many children's hospitals have done this, have put together a walk-in clinic that would serve patients that need to come in maybe after school. They're depressed, they have some anxiety, they have some school avoidance, and what do we do with them? So I'll talk about that in a moment. Third, we are looking at where we can expand outpatient services, potentially, and maybe in South Fayette. We have a 4th floor out in South Fayette. Am I echoing a lot? Okay. 4th floor at South Fayette is vacant right now and it is shelled, and there is potential. We would need some help with funding here, but we may look at this as a priority if we can provide additional services out there. So that would be a potential area. We're also looking out in the north. From an experience perspective, we do know that there are some children. I shared with you average 27 a month that we're sending over from our ED to Western. And probably about 3/4 of it, when they get there over to their emergency services, end up having to stay as an inpatient. For those children and adolescents at Western, we want to help to improve the experience. I don't know if I can stand here and say it's going to parallel the experience of children's. Western is a different entity. Psychiatric and behavioral health has different requirements from a regulatory perspective that needs to be included, but I do believe we could work together to do more. I do meet regularly with the president of Western Psych, Abby Schlesinger, to talk about how we can continue to help them share some of what I believe we do very well here from a patient-family experience and share that with Western Psych. So that is a work in progress. These are 4 top initiatives on how we hope to do a better job with behavioral health. I'll touch upon, before I move on, but I want to touch on the behavioral health walk-in clinic. In February, just a few weeks ago, we did initiate a soft rollout. And I'll say soft. This is not out for media. This is not out to say Children's has a walk-in clinic at this time. But with the help of Kristen and Dr. Schlesinger, we have been able to begin with select CCP offices to schedule and send patients after school from 5 to 9. And we have seen patients. In March, beginning next week, I believe it is, we are going to expand to all CCP. And a few weeks after that, we're going to expand to our pediatric subspecialty practices here. So that if you had a patient, we would be able to call and see if you can get them in after school from 5 to 9. Eventually, and hopefully by the fall, maybe a little bit aggressive, but I believe in putting timelines out there to get things moving. By the fall, we hope to have a rollout where we can put this out there and we can advertise that we have a walk-in behavioral health clinic for teens and adolescents after school. So this, I would say, is in infancy stages, but it's off the ground, it's exciting, and we have plans to continue to roll that out. A lot more to come on the behavioral health front, but I would say things are progressing. And if you looked a year ago to where we are now, we're doing more. And if we say a year from now in 2024, my expectation is we'll be even further. I'd like to move on to another one of our priorities, which is the Heart Institute. We are looking to elevate and really create a Heart Institute into a concept of a destination center. Right now, many of you are familiar with our 3rd floor cardiology clinic. On the 4th floor, we have our cardiac ORs. On the 4th floor, we have currently 2 cath labs, both of which needed updated and rehauled. We repaired. They were breaking down pretty much weekly or every other week, and we needed to replace them. This is a big investment. Why cardiac? Cardiac is our number 3 program right now in the country. We know that cardiac care is not delivered everywhere. There are cardiac cases we do here that are not done in every children's hospital across the world. It's an important center of excellence for us. There is going to be an investment of about $62, to be exact, $1 million to create a new heart institute. When you look at the Heart Institute, and this is a picture that I want to share with you here, an architecture rendering, the placement for this Heart Institute will be just if you go over the Rainbow Bridge as you're heading back to the hospital today and you look out to the left on the patio there, over top of the mid-campus garage, there will be 3 floors. The 3rd floor, the top floor right now, will be shelled. Okay, the project started out in full transparency several years ago at about a 30 or 40 million. Given inflation, and supplies, some HVAC, mechanical issues that we needed to add in, this soon got to a $60 million project. Things are not inexpensive these days, as all of you well know, and nor when you go to put up a couple floors and a few new cath labs, it's expensive. But I'm pleased to say that we have secured funding. UPMC is supporting this half, and our foundation, under the direction of Rachel Petroselli and her team, have agreed to support the other 32 million. So this is a very big investment by our system and our foundation. Within these 2 floors, I'm sharing with you the floor that has the clinical space. To the far right of the picture where I've outlined in green, you will see there are 3 cath labs. We will begin with 2. 1 will be shelled. But what's most unique here is there will be an actual ICMR, an interventional cardiac MR, which is state-of-the-art technology for children and adolescents that right now we don't have this. We certainly have our cath labs and we have MR, but they're not seamlessly together where a patient can go from cath lab to MR and back to cath lab. This is somewhat similar to on the 4th floor now, we do have an intraoperative MRI where children who may be having a brain tumor resected can go right into the MR and go right back into the OR post-scan. So it's a similar concept there. It is innovative state-of-the-art technology, and we're very excited about this. Eventually, this is what we hope to look like. This is a view from our 45th Street here. In addition to that 3rd floor, in addition to the cath labs, the MR, there will be a pre-op, post-op area. So children that come in as a destination center, we want to be able to say, you come in and you enter and exit in one area in the same building. They would not be going through our current 4th floor same-day surgery, but they would go in and enter and be pre-opt, register, waiting room, pre-op, cath lab, scan, come back out and be recovered post-op in that area and be able to go home. So it is a true heart institute. Several top children's hospitals that provide the exceptional cardiac care have concepts similar to this. So we are thrilled that this will be an expansion and probably the biggest expansion and capital project that Children's Hospital has embarked upon since we moved into the new campus here. I want to touch upon service and the delivery of service. We talked a lot about how we're going to grow, how we're going to expand behavioral health, and whether we're talking about cardiac care, hospital medicine care, emergency care, surgical services, outpatient, all of the care we deliver. Quality is important, safety is important. But I am a believer that just as important as the quality in service is the how we deliver in that service, how we communicate, how we approach our families. We've learned over the past couple of years with the consulting engagement with the Studer group and the Huron group that it takes 40 seconds to demonstrate compassion. 40 seconds. And I know some of you who have read about this or we've sent out some articles on it have probably heard that. But it bears worth repeating. In 40 seconds, every one of us has the ability to make a significant impact on that patient and family. Research also says, and evidence is out there, we talk about committing to sitting. Some may say, we don't have time, and I believe you, you are busy. But there's some literature that will say, if I walked in the room and stayed standing for 2 minutes, but you walked in and Sylvia Choi walked in and Dr. Choi sat for 2 minutes, it's going to make a difference. And that patient and family is going to feel that Dr. Sylvia Choi was in there longer than Diane Hupp. We might or may not believe it. Could be perception. Sometimes perception's reality. But these are things we've learned through spending a lot of time on how all of us, myself included, can improve our service to our patients and our families. We talk about little things making big differences. We talk about owning our zones, and every time we walk up and down the hall, just looking at each other eye to eye, not even taking 40 seconds, not taking any, because you're going to continue to walk while you look up and make eye contact and say hello or good morning. It's simple things like that that I do believe change culture in organizations, and we're working really hard on it. In 2022, excuse me, in 2022, we were able to demonstrate that and showcase our work through a slide here. It's a busy slide, but you can see over half of the UPMC hospitals, and you see children's to the far right at the 86th percentile, compared to the year before at the 82nd percentile. What does that mean? In a nutshell, that means that patients who are completing surveys, we know that it's the number's not statistically significant, albeit we know we send home 11, 12,000 children discharged from the hospital and we only get back 1,200 surveys. We know that. But people who live and breathe this and have studied this for years tell us it's a myth about the numbers. Focus on the trends. I do believe that. We've focused on the trends and we've been able to improve. 86th percentile means that we are near to the top decile in the country of 156 children's hospitals who participate in Press-Ganey surveys that provide us a 9 or 10 on a Likert scale of 1 to 10. That's what that means. We've done a great job. We didn't start out the year as strong, I will tell you. Over time, we've been standing here in the 80th to 90th percentile for 4 years. That's very hard to do. January this month, I'm not going to get too excited, but I must call it out and be transparent. I had to add this because the report came in yesterday or the day before, so I had to add this. 66th percentile. Now that represents about 100 surveys. It's not a huge number. I'm proud to say that several of our units, including a unit that was struggling last year, 7C, thank you, hospitalists, are at high at the, I believe, 90th percentile. So something is changing. Could be patients and families' perceptions, because that's what this is. But we do have ability and we have best practices that can change that perception. My ask of each of you, there are 2 things and they're not new to you. Because we've actually, over the past years, I'm proud to say, past 12 months, have had a couple months of great improvements with physician communication to the parent and to the child. That green arrow there really looks like in December, we hit it out of the park. January, not so much. The arrow would be going downward. But that's okay. It's 1 month and we have an opportunity to make impact. Communication is the key. Nurse communication, physician communication. That is key to patient-family experiences. We know we have children waiting in our ED. We know we have children that aren't in licensed beds. We know we have delays to the OR. We can't control all that. We can't control all that. I ask my team, focus on what's the controllable and what you can influence. Continue to introduce, continue to make connections with our families, continue to take the extra 40 seconds. Sit when you can, while at the same time being honest with them about your time constraints. It'll make a difference. I want to end in the last couple minutes on our people. All of what we talked about today and each of these priorities and each of the pillars, foundational pillars of our work could not be possible without our people. It's so important. I do want to share a big win that UPMC has invested nearly $600 million in our people over the past 2 years. I won't read all of these to you. I know the slides will be available, but much has been done, even though I recognize that some of our staff and even our physicians, we need to look to ensure competitive pay. I recognize that. We are a big organization. We are 90,000 strong in the UPMC health system. So when you look at 600 million and say, well, what does that mean to each and every person? It's different. It varies, but there has been an investment made. Has it helped? I would say it has. The turnover is plateauing. It's coming down and plateauing. To the left, you can see the blue line, which we were as high as 18% in overall, and we went down 1%. And 1%'s a lot when you're talking about 3,000 individuals. When you look at nursing turnover, done a great job from 18 to 14%. We are moving in the right direction. We're not quite where we want to be, and we want to continue to lower this, but we're moving in the right direction. We'll continue to grow our workforce. We must. I'm pleased to say the vacancy rates are decreasing. We have a strong recruitment of GNs and RNs. Last year, we hired over 400 RNs, GNs and RNs, 400. Huge number. From a physician perspective, we went up 5%. This is strictly headcount. Thank you, Mike Communal, for sharing some of this with us. When you look at what we're moving towards, we are moving towards looking at our replacements. We have 24 faculty recruits, 25 more in recruitment, and that's just for replacements. But when you look at the new, we are also looking at making smart investments in divisions that we know we need to invest in for access, for meeting all of our outpatient appointments, for taking care of our inpatients and consultants. We're continuing to look at every physician chief that comes through with requests on an individual case-by-case basis and make investments. We must do that. I shared with you the growth at the beginning of all of our impressive results in terms of numbers. We need to continue to invest in our people, including our physicians. Please know I'm working closely with Terry Dermody and Mike Communal on what that means for every division in prioritizing not only the physician recruits, but the support staff too, that I knew needs to come through. We've released positions already this year, last month, and Mike sent me additional positions yesterday to say, can we put those forth? Positions for support, whether they be nurses, OS specialists, some type of administrative support to help us continue to provide the care that we're providing. I leave you with my commitment to continue to listen and learn from every one of you and share with you that I do believe by listening well, you continue to learn and we continue together to build a great culture. We have a great culture here, but you can't stop. You can't rest on the accolades and the laurels that we've had. So my commitment is I have monthly listening sessions. I've gone to monthly faculty meetings with Terry and happy to go with others that who would welcome us to listen and to try to help. My job, I believe, is to help you do what you do best every day out there. We have monthly virtual town halls. We're still getting 500 plus individuals on town halls. Questions are interesting. I do my best to answer each and every one in the order they come. I really do. Monthly employee appreciation events. Every month we'll be doing something. Friday, that's tomorrow, it's Employee Appreciation Day, March 3rd, celebrating throughout our entire system. So we'll be greeting you, giving you a small token of appreciation for what you do every day. I will continue to send out a monthly message I want you to remain informed. I want you to be able to continue to communicate all of the great work that we're doing here at Children's Hospital with the recognition and understanding that we know we have challenges. Across the nation, we're being challenged in healthcare now more than ever. But I feel blessed because of each of you and your teams that we have out there. Organizations will survive if they continue to grow, if they continue to recruit and retain top talent, and if they continue, I believe, to build cultures and build upon the strong culture that we have here at UPMC Children's Hospital. I very much thank you for your time today. I thank you for listening to me. You didn't have to be here. You're also very busy. I would be happy to take any questions you have. And I leave you with my commitment to continue to support you in every way that I possibly can. And I'm grateful for what you do. Thank you.